thank everyone for your participation, for your cooperation, and we just need to keep it up, and especially in the month of April. But I want to stress the month of April is going to be a very critical time, not just for our city, but quite frankly for our country as well. And you've been hearing that over the weekend. The health experts tell us they expect to see the number of positive cases and sadly even the number of deaths to rise in the next 7 to 10 days. And April is our month to do everything we can to flatten the curve. So we are going to have to be very, very intentional about what we intend to do over the next several days and in the month of April. Let me give you the latest numbers. And again, let me emphasize, I don't like to get caught up on numbers, but it is important for us to provide these numbers to you. Today, the Houston Health Department is reporting 402 positive cases for the city of Houston, and that brings for a total of 1,145 cases in the city of Houston. Now, let me explain that. In part, that is because we are getting, this is in that 402, and Dr. Peirce can elaborate, that's a backlog number. It's not 402 cases from yesterday. If you notice, yesterday we announced 53. On Saturday, we announced 103. Today, the number is 402. Two-thirds of those cases back up to mid-March. But we are now just getting the results from a particular lab, and so now they're being factored in today's number. So I want people to know, this is not that all of a sudden from the testing that was done on yesterday, for example, there are 402 confirmed cases. That's not the case. Just like I believe it was a couple of weeks ago, on a Saturday, our number was at 60-something, and then all of a sudden the number went to 232. That was because of the backlog of cases coming from either LabQuest or the other one was Quest Labs. This one I think is LabQuest. And so these are numbers that stem back, two-thirds of that 402 stem back to mid-March that are just now being calculated. In large part, I think we can say to some degree that these numbers have been factored already into those who have either been notified previously, but now we're just reporting these numbers to you. So that number now is in the city of Houston, total 1,145 cases. And again, as I've said to you before, there are more cases out there. We know there are more cases out there because the testing is not nearly as robust as we would like. Now, on the positive front for today, there are 0 deaths that are being reported in these numbers. 0 deaths. And what does that mean for the city of Houston? Council member, Mayor Pro Tem Martin, the total number of deaths in the city of Houston as of today stands at 10. And that's 10 too many, okay? But when you compare that to well over the 9,600 people who have lost their lives across the United States in the city of Houston, the total number of deaths stands at 10. 10 of that roughly 9,600 plus. And so that's good news, even though it's 10 too many. And certainly I want to thank all of the doctors, nurses, the healthcare providers, the medical centers, so many others who are just providing stellar care in the city of Houston and beyond. So that's where we are. And in order to keep those numbers from growing even more, again, I'm going to ask people to practice social distancing. As you can see, we all have our masks on, and I'm going to encourage people to put on your mask because you can be asymptomatic, but that doesn't mean that you are not you're not spreading it to someone else. So it doesn't have to be. It could be face coverings. You can design yourself. You can customize it to your outfit. This one is colored on the outside blue, matches the blue suit. So that's however you want to do it. you know. But the point is, when you're out working, even in going to the grocery stores, put on some sort of face covering, and that will help to keep people safe as well. In terms of where we are with the City of Houston employees. In fact, let me just stop right now and I'll pick back up. Dr. Purse, why don't you come, since I'm talking about the number of cases, and you can speak to that.
Thank you, Mayor. Three things. One is the numbers, as the Mayor pointed out, is a large increase today, but this is spread over a fairly broad period of time. This is one of the challenges that we have in public health, is that we don't get the reports on a consistent daily basis from the labs that do these. LabCorp is one of the large national labs. It's doing the testing for FEMA, and they're doing thousands and thousands and thousands of tests every day. And it appears that they have sort of collated a bunch of the results and sent it to us all in one bolus. Quest Labs did the same thing, and we are anticipating that they will get better at this. But this is a big burden on them, too. This is a lot of work for them. And so while it is frustrating for all of us to see these sudden jumps in the numbers, we need to, like as the Mayor pointed out, we need to pay attention to what the numbers mean overall, and not in any one specific day's jump. And again, as the Mayor pointed out, probably the most important number for today is that there were no deaths reported yesterday. And we are fortunate, if you or somebody who's tracking the numbers, the hospitals are obviously very good at letting us know, and the medical examiners know, letting us know within a day, or sometimes, and with the hospitals, they're letting us know pretty much within a day. And sometimes with the medical examiner's office, they'll have someone that test on that patient will come back several days later, but they're pretty close. So the deaths seem to be a little bit more timely than the lab, but again, just look at the slope of the curve and not the sawtooth pattern it has. So that's about the numbers. Number two, about the masks, I just want to remind everyone, the mask that you wear, the surgical mask that you wear, is not designed to protect you. It's designed to protect the people around you, because there is this phenomenon with this particular virus of asymptomatic spread, which is much more prevalent with this virus than viruses that we have seen over the centuries. Is a very different characteristic of this virus, which has caused it to spread widely. So the mask that you wear does not mean that it's okay to gather in large groups, because the mask that you wear does not protect you. It protects the person next to you in case you are one of those people who is infected and unknowingly infected and spreading the virus. So to that point, the issue of social distancing remains just as important as it always has. And to that point, we have a graphic here that I want to point to, and I can't see it, so I'm going to try to recite the numbers as best I can remember it, and that's fine, is that it shows, so there's a value in public health about infectious diseases, and we call it R0, which is a capital R with a small 0. Thank you, Chief. And what it shows, what that is a value of, is a rough estimate of how infectious a pathogen is. And what it really means is, if one infected person were to be exposed, were to enter an environment with 100 other people, how many other people would become infected from that one person entering that environment? The larger the number, the more easily the infection is spread. So with the seasonal flu, it's about 1.1, and we see how much the seasonal flu spreads across the United States. With this virus, it appears to be about 2.4, 2.5. Some estimates have it as high as 3. So on this graph, what you're seeing is if one person infected 2.5 people within a 5-day period, and then those 2.5 people, over the next 5 days, each infected another 2.5 people each, and so on, that at the end of just 30 days, that one person will have infected 406 other individuals. The next line down shows that if that first individual had social distance to the point that instead of infecting 2.5 people, they infected half of that, 1.25, at the end of the 30 days, the number goes from 406 down to 30. And if they social distance even more, and now they infect 0.6 people in a 5-day period, and each one of those social distances as well, the number drops down to less than 3 people. The impact of social distancing cannot be understated. It is vitally important that everybody understand that, and that we wear our masks, and that's what's going to get us through this. Thank you, Mayor.
So with respect to these numbers, what's important to me is not necessarily the number of cases, confirmed cases that we're getting, that we're giving to you every day. I am certainly looking at what the death toll is, because regardless of the testing, that gives you some idea of the severity that is hitting our city. So today, our number is at 10, no deaths being reported today. The other numbers that are important to me are the number of people who are reporting to our hospitals, which gives some idea of the ability of our hospitals to meet the need. And based on the information that I've been provided, the charts that I looked at, we are still well within the hospital's ability to handle the load. The other number I look at is the number of people in ICU and the number of ICU beds available. And as of today, that's still within the hospital's ability to handle people who need ICUs. Look at in terms of the people on ventilators, the numbers that's available and numbers that are on the ventilators. And as of today, our hospitals are able to handle that load. Now, so the single objective is to flatten the curve, to slow the progression so that our healthcare delivery system is not overwhelmed. As of today, we are achieving that objective. Ideally, what we are seeking to do is not just to achieve that objective today, but every day in the month of April as we move forward. That's the objective. Regardless of the numbers that we are reporting of confirmed cases, are we slowing it down enough so that our healthcare delivery system can handle the load? And that's what that's our purpose and our objective. And just like Dr. Peirce said, social distancing does work. It does work. And so please govern yourselves accordingly. A total of 68 City of Houston employees, including fire, police, and municipal workers, have also tested positive for COVID-19. That number is 68. 28 are municipal workers, and 19 are firefighters, and 24 police officers. We've also had several first responders in quarantine because they are either exhibiting symptoms and are awaiting test results. And again, that's 19 fire, 24 police, and those are the cumulative numbers. And so to speak more specifically about their particular status, let me call on Chief Pena with the Houston Fire Department, be followed by Chief Acevedo with the Houston Police Department. Chief Pena.
Thank you, Mayor. So for the Houston Fire Department, our call volume has remained essentially flat this last month. We are seeing an uptick in the types of calls, and it's less motor vehicle accidents, but certainly more medical calls. 89% of our call volume has been in the medical category. In general, our personnel are doing okay, but there are concerns. There are concerns that they may take this thing back to their families, and social distancing and physical distancing at the stations is sometimes not easily achieved. But especially with the rising presence of this virus in our community, the Houston Fire Department has tried to stay ahead of the curve and adapting our protocols and our procedures to ensure that we're keeping our personnel safe. We've already hardened our facilities. All our stations are closed. There's a central entry point for people that want to gain access into those fire stations. We've made changes to the protocols as far as our approach to medical calls, where anybody within a 6-foot distance of a patient is to wear their entire PPE, personal protective equipment. That means gloves, their goggles, and their masks. And we're moving to the next phase. As you can see, I don't have a mask right now. We're ensuring that we're delivering these masks today to our firefighters, because the next step in our protocol is to require firefighters to wear these surgical masks throughout the day at the fire stations. And those are going to be delivered and start to be deployed today. As soon as I leave here, Mayor, that's where I'm going, is to secure a few masks for myself as well, because it is important. And it's about protecting others, not necessarily to protect you, but to guard from you spreading this virus. The next thing we're going to be doing with our firefighters is we're going to be doing a wellness assessment before they come on shift. That's going to be forthcoming, where we're going to check temperatures. If our firefighters are exhibiting a fever, they will not be allowed to come into the facility. Reason being is we have 220 firefighters in quarantine at this time. 165 of those have been as a result of employees that work asymptomatic. They get off shift, they deliver symptoms, and the protocol is, following CDC's guidelines and the health authorities' guidelines, is that anybody that they worked with within the past 24 hours, now it's 48 hours, correct? Now they have to be in quarantine. So the majority of our people in quarantine has been as a result of our own personnel coming in, and they may be asymptomatic, but the protocol is that they will reach back 48 hours, and everybody that they worked with now has to be in quarantine. So in order to prevent that further, the wearing of the mask is going to be mandatory moving forward. As I mentioned, we have 220 firefighters in quarantine. 30 of those are in a city-provided facility. We have a total of 19 firefighters cumulative since this operation began that have tested positive for coronavirus. 5 of those have since returned back to work. And it saddens me to report that we do have 1 firefighter in the hospital. He is not in ICU, but he is admitted at the hospital and he's being treated. Word I got from our chaplain is that he's doing well. The doctors expect a full recovery, but still, the fact is that he was ill enough to be admitted into the hospital, and that's a concern for us. Personal protective equipment, we have an adequate amount of supply in our inventory. We do a continuous inventory of our personal protective equipment and consider the daily burn rate to ensure that we have enough materials for our firefighters to safely perform their job. And regards to helping our first responders, firefighters, police officers, as well as city employees that are out there, we ask the general public to please, we can do 3 things. Maintain proper hygiene. Wash your hands several times a day. Maintain that physical distance, because that's going to slow the spread of this virus. And if you can, stay home. Stay home. That's probably the best advice. You can't get sick if you don't catch it. So with that, I'm going to turn it over to Chief Acevedo.
Good afternoon. Thanks, Sam. First thing I'm going to do is give you a cumulative update on the cumulative numbers of the Houston Police Department personnel that have been impacted by the COVID-19. We have, as of today, as of this afternoon, 125 total personnel that are quarantined, 105 classified or sworn personnel, 24 civilians. 123 members of the Houston Police Department have been tested for the COVID-19. 109 classified or sworn have been tested. 24 are now positive for COVID-19. That's 24. Yesterday was 19. We had 5 more today. 44 have come back negative, and 51 tests are still pending. As far as civilian personnel, we have had 4 that have been tested for COVID-19. 1 has come back negative, and 3 are pending. The good news, we've got some good news to report. We now have a total of 4 frontline officers that have tested positive for COVID-19, and 4 have now come back to work. And so that's a really good news. The other piece that is important, that we've been putting out calls for prayers for our 1 officer that remains hospitalized. He's still on a ventilator, but we're starting to get some signs of real hopeful signs. And so to the community of faith and people that want to just meditate and think about our employee, please keep praying for him and his family, because we had some hopeful signs today. He's still in a tough spot, and one of the things that we know is that you can go up and down, and so do not stop praying for him and everyone else impacted by this virus. As far as the police department's operational status, we're 100% operational. All units are fully staffed. As a matter of fact, our visibility across the city continues to be increased by having our men and women, regardless of assignment, don their uniforms to have the heightened presence. Call volume is slightly lowered. It's gone down a little bit. I think it speaks to the fact that Houstonians we're a community. This isn't our first rodeo, thanks to Mother Nature. And we're a great community that actually tries to do our very best to be part of the solution, not part of the problem. Crime continues to soften with this, with a couple of exceptions. The first exception, obviously, is the burglary of buildings. Again, that's part of that is attributable to the fact that many businesses are closed, and criminals are trying to take advantage of that. Like I said the other day, if you have a business that's closed and you want us to put more eyes on it, please call your local division of the Houston Police Department, and we'll add your location to our directed patrol to keep an eye on it. But more importantly, when you're driving around, critical issues, dealing with issues in the community, and you see something suspicious, please report it. The other crime that we're worried about that's gone up is aggravated assaults. Aggravated assaults in the city of Houston have gone up 10% since the implementation of the city and county COVID-19 shelter in place or shelter at home or essential business only order. That's a 10% increase in the last 3 weeks. Or last 28 days, 50%, this is really important, we've talked about it, 50% of all aggravated assaults are domestic violence related. So we have a 10% increase in assault, and 50% of them in the last 28 days are domestic violence related. It's important to note that typically the number of assaults that are domestic violence related it runs from 36 to 38%. So we've gone up upwards of 10 to 12% in terms of our assaults that are domestic violence related. Aggravated assaults at residential houses is up 70% since city and county orders were implemented as compared to the same time frame last year in 2019. It's really important for the community to do two things. One, remember that we're all coping with this. I think a lot of people are having nightmares. I'm happy to report that for the first night in quite a while, I slept without a nightmare last night. So there is hope. If this crazy mind can rest one night, maybe yours can too. Let's walk away when you're in a fight about something, you're arguing about something. Just turn around, walk away, go to another room, go to the backyard, go to the front yard. Just create space. Social distancing sometimes is not just about the physical and the virus, it's also about the mental, the emotional, and the situation that we're all dealing with, the added stress. Just take the time out, give yourself space, and most importantly, don't be afraid to call for help. We have a 24-hour communication center with mental health professionals available, and there are a lot of hotlines that you can call as well, but we're here for you. And on behalf of all the men and women of the Houston Police Department, I want to just tell the community thank you. Thank you for being great partners, and most importantly, thank you for relieving our call volume, because again, when we all just make better choices, I think it better prepares the police department to focus on what matters most, and that's combating violent crime and property crime. And so that's my report, Mayor.
Let me thank Chief Pena and Chief Acevedo. As of today, we started providing additional masks to our municipal employees as well, because it's also important for us all to do our part. Last week, I asked the Houston Parks Department to remove all basketball rims from city parks, and over the weekend, they began removing volleyball nets as well. Parks are getting too crowded, and park employees and police will enforce social distancing. And again, I want to emphasize, I know this month of April with Passover, Easter celebrations, normally people would be out in the park, Easter egg hunts and all of that. But let me just say, in the month of April, we're going to be very intentional about enforcing social distancing, even in our parks and green space. So let me bring up Steve Wright to speak on those initiatives. Steve Wright.
Once again, thank you, Mayor, for supporting all the initiatives that we've sent out. As the Mayor alluded to, we've got 380 city parks throughout the system. Throughout those city parks, we have 250 playgrounds. All of those playgrounds have been roped off. We've ordered 1,200 signs, 800 in English, 400 in Spanish. We got more signs on the way, so all playgrounds are clearly marked off. Signage is up. Also, within 3 days, the Parks and Rec Department, whom I can't speak highly enough of, were able to remove over 450 basketball goals and or secure them for non-playing. Our intent on this is to help minimize greatly what we're terming recreational grouping. Getting a lot of phone calls about what types of sports are allowed, what types of activities are allowed at the parks, and the easiest way for us to convey a consistent message is no recreational grouping outside. This is for everyone's safety. If there's an activity that you can do outside, and there are many that you can do and keep 6-foot distancing, we encourage you to do that. 380 parks. Also, throughout the city of Houston, over 50% of all residents are within 10-minute walk of their park. That means 1.2 million people within 10 minutes can walk to one of their city parks and or trail systems. So at this stage, we're monitoring it on a day-by-day basis. We've also implemented a park monitoring program. We've reassigned park and rec personnel to help go out to these parks, remind people no recreational grouping, remind people 6-foot distancing, showing people what that means. We've also been working very closely with the police department. Thank you, Chief, for helping us out with that, to help provide additional eyes, ears, and monitoring and reminders out at these city parks. The upcoming weekend is historically one of our busiest weekends at the park. We understand people want to go outside, get active, get together, come together in groups of people and celebrate this upcoming weekend. We're asking people to please, if that is something that you want to do, if you can do it with no recreational grouping, if you can do it and stay 6 feet apart, we encourage it. If you cannot do it, please go to another park. Please find another trail. Find another activity closer to your house. There are ways to get out and enjoy nature, to get out of the house. One of the things that we are taking a look at, we have not implemented because we're watching it on a daily basis, is the possibility of limiting some of the parking at some of these parks to help encourage people not only to walk to the parks, but also possibly to go to other parks as well. So once again, I want to thank the mayor for helping support these initiatives. This is a very serious issue. When the order originally came out, I think what people somehow, some way took it upon themselves to move from inside to outside. So the outside the parks became the new convening and congregation area out there. We enjoy the activity at the park. I am going to ask on behalf of the Park and Rec Department to please remember, if you bring it into the park, please take it out of the park. That'll help us keep our parks clean, safe, and organized. So on behalf of Park and Recreation team, who I can't say enough about, on behalf of the mayor, thank you very much.
Thank you, Director Wright. So let me emphasize the month of April, we're going to be very, very focused on maintaining social distancing in our parks. And if necessary, we'll close down the parking in the parks, if necessary, to achieve our goal of social distancing. April is the month. This is the month when we're all working hand in hand to defeat COVID-19. Finally, I want to recognize one of the leaders in our community who is setting an example by assisting first responders and those who have lost their jobs as a result of the coronavirus. Swamnil Agarwal is the CEO and managing partner of Ninyan Capital and Kalyan Property Management. Through his foundation, Kalyan Cares, apartment tenants will benefit all 20,000 apartment units owned by Kalyan in Texas, Nevada, Utah, and Kansas, and they will receive or be offered up to $1,000 towards their apartment rent. This applies to all tenants who have lost their jobs due to the coronavirus. The total amount being made available to his tenants is roughly $4 million. In addition, he is also making a major contribution to our first responders as part of the PPE donation drive at Minute Maid Park scheduled for this coming Wednesday from 12 to 3 at Minute Maid. And this is being done by Chenier, the Astros Foundation, and Project Cure. And so where we're asking people, companies, corporations to bring your PPEs to Minute Maid, 12 to 3, all of these supplies are going to our first responders and healthcare providers. To achieve that purpose, Swamnil Agarwal is donating for the acquisition of those PPEs, $100,000 for police, $100,000 to fire, and $100,000 to the Harris County Sheriff Office. I'll give it to him. So I want to thank him for being one of our largest apartment owners, just like Camden did. Rick Campo did the same thing on last week, and now Swamnil with 20,000 tenants in Texas, Nevada, Utah, and Kansas is also doing the same. So let me introduce Swamnil with more on what he's doing. Thank you so very much. Come on, Swamnil.
Thank you, Mayor. Thank you. Sorry, I had to take my mask off. I'm not used to talking with the mask on. But you know, as a businessman and as an entrepreneur who grew up in Houston, I think this is the least I can do for the city that has given me everything. Our company is called Nitya Capital, and a sister company is called KTRK Property Management that manages all these apartments. And our foundation is called KTRK Cares that will be providing rental assistance of up to $1,000 that will be applied towards their rent people who have been directly affected and have lost their jobs because of this devastating virus. In addition, the first responders, the police department and the fire department and the sheriff department, the least we can do for them is to make sure that they're protected and their safety is of ultra importance to somebody like us, because they're trying to help the whole city in this time of need. So that's a decision we made to make sure that they have the protective gear and they're able to perform their services without worrying about getting sick themselves. So it is my honor, and hopefully we can all overcome, the city can overcome, and that this nation can overcome this enemy that we're facing, which is a faceless enemy. And hopefully within 4 or 5 weeks, we're all back to our normal life. And Karya and Nitya and myself personally will be available. If anybody has any other needs or they want to reach out, would be more than happy to support in any cause. Thank you.
Thank you, Swamnil, and really appreciate it. Houston is an amazing place with some amazing individuals and business leaders as well. So thank you so very much. Okay, we'll pause right now. We'll take any questions that anyone may have.
Okay, Mayor, Houston Chronicles asked if there apparently is a program through Harris County for $10 million in small business loan fund to help firms with the trials that they're having during the pandemic. Apparently, Commissioner Garcia has indicated that he hopes the city could contribute to the fund. Is there anything in the works on the city side in regards to this?
We're looking at it, but at the same time, we're trying to balance a lot of competing needs. But we're looking at anything that we can do to assist businesses, especially small businesses, within our capability. We certainly will. But no specific plans have been laid out at this point.
Okay. There's a question about a White House advisory that Americans should try to avoid grocery stores and pharmacies over the next 2 weeks as the outbreak is expected to get worse. And do you have a message for Houstonians regarding these 2 weeks and doing anything even more cautious in this period?
Well, the points that I want to emphasize is for us to continue to do what we have been doing and even more so. And that's engaging in social distancing. That's the critical component. Stay home. If you're not working for an essential employee, if you have to venture to, let's say, to the grocery store or to the pharmacy, make sure that you stand 6 feet from the next person. So engage in social distancing. That's whether you're at home, whether you're at the grocery store. As we've repeatedly said, we're not closing down the grocery stores, and there's no problem with the food supply of grocery stores. But social distancing, as Dr. Peirce said earlier, that's the key component to all of this.
Are you hearing any reports of fast food workers or grocery store workers who have been getting tested positive for the virus, and is that concerning you?
I am sure that every sector, there are people who have been tested positively, regardless of what organization or business you may be in. Same thing with respect to City of Houston municipal employees, same thing for the county. I think if where there are people, there have been somebody impacted in some shape or form. And I think people are taking proper precautions to try to keep that to a minimum as much as possible. And so I want to applaud people. There are businesses that are putting up facial shields, glass in front, glass behind their employees, providing them with masks and other things, cleaning on a regular and systematic basis. So there are a number of things that are taking place in order to keep these essential businesses going.
Now, obviously, there's been a lot of discussion about President Trump's recommendation that the anti-malarial drug chloroquine and its other counterpart could be very helpful in the fight against the coronavirus. Obviously, there's been some caution on the medical side about that without any clinical trials to back that up. Are you concerned about the advocacy for this drug absent some of this more scientific basis?
Well, let me stay in my lane. Dr. Peirce?
Thank you, Mayor. So I think that, now is not a whole lot different from any other time. So medications, all medications are designed and have a specific purpose. when misused, there are often consequences to that. And so whether it be chloroquine or some of the other medications that we're hearing, they really need to be used properly, which means that they need to be investigated properly. Everybody right now is looking for something to give us an edge against this virus. And I, as a physician, I thirst for that as much as anyone else. But also as a physician, I have seen, in having been taught medical history, how over the decades we have been too anxious and had consequences where more people got hurt than were benefited. And so while I respect that the president is looking, like all of us are, for something to help us out, we still need to be responsible and investigate these drugs in the right way so that we don't hurt somebody.
There's a question for Chief Acevedo from one of the Spanish stations asking for a Spanish response.
We were actually planning on doing Spanish on the sidebar later, so, but happy to do it now if you'd like me to.
Okay, it was just are there reports of increased aggravated assaults in the city during this time?
Sí, desgraciadamente en las últimas 3 semanas hemos visto que los asaltos agravados serios han subido por como 10% y desgraciadamente el 50% de esos son violencia doméstica. Es importante que las familias, las comunidades sepan que si es víctima, no tenga temor. No importa si estás aquí indocumentado o no, por favor, reporte la violencia doméstica. Vaya a un negocio, vaya a una casa, vaya a casa de un amigo, por favor, reporte lo que estamos aquí para protegerlos.
Another question for you, Chief.
Yeah. Is this Spanish again?
This has not been requested to be in Spanish.
Okay.
There's been some concern about obviously churches and other organizations gathering in large numbers. The Governor Abbott's order kind of seems to exempt them, but is the police department responding to a substantial number of complaints about businesses or individuals who are gathering in violation of the order?
No, we're not getting that many complaints. We had a couple about some of the parks, and obviously when our officers responded, people immediately, once they were reminded of the social distancing requirements and the current health requirements in their city, complied. We had one complaint this week of a bar that was trying to be a speakeasy. And word to the wise, if you operate a bar and you're trying to be a speakeasy, word gets out, we are investigating those. There's only been one, and we did investigate it, and we didn't find any irregularities. But there will be no verbal warning. There will be no warning. There will be immediate enforcement action with us and the fire department, and we will do everything we can with TABC to request that they take action on somebody's liquor license if they violate this order by recklessly putting us all in danger by having people come to bars and congregate and be inside that establishment. So we did investigate one this week, and we didn't find any violation.
If there are concerns from the public
You need to
about
call it in.
Call the police non-emergency number?
Call the non-emergency number. If you think it's, you can call 311 and it will be transferred, or you can call the local division of the Houston Police Department, your local station, and we'll jump on it right away. I promise you. Let me tell you what happened this weekend. We had because the work goes on for the police department. We are fully operational. We had some full gang members on social media pointing a gun at a police officer, or the police officer from the Houston Police Department didn't know he had a gun pointed at them. Those two crooks are now in custody. So if people think that we're not operational, they're sadly mistaken, and we have 2 gang members that now found out that in a matter of hours after they posted something on social media, which was a threat, they found themselves behind bars where they belong. Okay? Is that it? Okay, thank you very much.
There was a question, were you going to ask about the testing? Okay, I'll let you ask that question.
Let me just say you can, call 311, and then if you want me to do it in Spanish, tres uno uno.
Mayor, good afternoon.
Yes.
I hope you and everyone else up there are healthy at this time. Your thoughts on the testing situation? You've alluded to this. It was spoken to this morning with the Judge Hidalgo. The challenge is that the ability to test and the reports are not coming back in a manner that actually shows what's truly taking place out there. Your thoughts on that, sir?
Well, the testing is certainly not nearly as robust as we would like. We would love to be doing 20 to 30,000 tests in the city of Houston at this point, rather than roughly 5,000 that's been done. And those are the public tests. Now, there are some private testing that's taking place as well. That's not factored into those numbers. So we would love the testing to be more robust. But let me tell you what we are doing. When you compare the actions, for example, that's been taken in New York City, or New Orleans, or in LA, or Chicago, the city of Houston has been taking those same mitigation steps, irrespective of our numbers, okay? And we have been taking steps to mitigate this situation starting in the first week of March. And as you know, on March the 11th, the rodeo came to an end. On March 17th, restaurants, bars, clubs were suspended in terms of their businesses. Then March 24th was the stay home, work safe order. So even though our numbers have been relatively low, in part because the testing has not been as robust, we have not delayed our actions because of those numbers. We have been just as aggressive as New York and LA and all of these other places. And I think as a result of that, the number that I would like to emphasize, where in those other places, the death number is much, much, much higher. For the city of Houston today, we are at 10, okay? And in New York City, for example, I think the number may be well over 4,000. City of Houston is at 10. Now, that's not to say that things couldn't go dramatically wrong tomorrow. But if we continue to engage in social practices and social distancing, stay at home, wear these masks, face coverings, then hopefully, and the goal is that we can stay within our hospital delivery system, the ability to take care of people who are coming into our hospitals. That's the hope.
If you were to reflect back, let's say 2.5 weeks to where we're at now, would you be surprised to have the numbers at this point? Did you expect them to be higher than where we're at right now?
Quite frankly, based on watching television every night, all times of the day, and reading the reports, I would expect that our numbers to have been far, far worse. I would expect that, for example, the death toll to be much, much higher. And, at least at this point, and again, things are so fluid, and Dr. Peirce can correct me, the hospitals right now you're not hearing them screaming about ventilators or even about the ICU beds, things of that nature. Now, what they are saying, mayor, county judge, others, it is important that people not let up. It is important that everyone continue to be aggressive. It's important for people to still engage in social distancing and to stay home. That's what they are saying, and they're saying that we need to emphasize that over and over and over again. At the same time, they're going to do their part to take care of the people that are entering their hospitals. And that's why I was delighted to hear Chief Acevedo talk about the officer, because last week, the report was not good at all. And the fact that it's somewhat positive today is a good sign. And so what's important, from my vantage point, if we can provide our hospital delivery system the capacity and the time that they need to really focus their attention on treating the people inside their hospitals, to give them the care that they are needing, then that's a win for us. Okay, that's a win. And that's our goal, not to overwhelm our healthcare delivery system, such that if you need a doctor, if you need a hospital bed, if you need an ICU unit, and if you need a ventilator in the city of Houston, those things will be made available for you.
And maybe Dr. Peirce, this might be more towards you. Last week, the mayor indicated that the peak was around, I believe it was May the 2nd. Is the administration still operating off of that particular date, or is that window been bumped up to, let's say, 10 days from now?
Well, when you say the administration,
Are we still looking at May the 2nd for the peak here, or is it being moved up a little bit?
so from my standpoint as the city's public health officer, I appreciate the projections, but I recognize those are just projections. And we are living this one day at a time. And we're watching to see what our numbers do. One of the things I think that we have all noticed, and as the mayor pointed out, is that we are fearful of what could happen tomorrow. That is why what we do today is so important. And at this point, we have 10 deaths. That is 10 too many, but it's not the numbers that New York had. Now, Wuhan got blindsided by it. Wuhan had no idea what was happening right under their feet. They got blindsided. Maybe to some degree, the same thing happened in New York. So far here in Houston, so far as of this minute, it looks to me like Houstonians are doing a good job. But it could all change tomorrow. So the projections are just that, whether it peaks beginning of May or if it peaks the beginning of June. And remember, the irony of this is that the better a job we do of flattening the curve, the later the peak occurs. So in a perfect world, I would like to see it occur sometime in June and be very low. You follow me? Yeah. And so I'm living this one day at a time, working off the information I have now. I appreciate the projections, but I'm not hanging my hat on any projection.
My question to Dr. Pes, it's related to the vaccine trials. We've been reading that some trials are presently going on in the U.S. Africa has completely come out and said we don't want to be guinea pigs. And so what are your reflections? What is your advice to Houstonians vis-a-vis the trials, and what are their fears? And, you know, what do you really have to say to Houstonians about the vaccine trials?
So one of the things about vaccine trials, and we've talked about this before, so I'm going to give you a little bit of virology 101. And we've talked about this before, but to remind you, a vaccine is, think of like an M&M candy. It has a protein shell on the outside, and then on the inside is the RNA or the DNA, and in this case it's RNA, and that's what causes the problem. Your immune system doesn't see the RNA. The immune system sees the candy coating, the protein shell on the outside. And so when you make a vaccine, the first thing you have to do is you have to sequence the DNA in the virus so that you can then start creating the protein shell and start creating virus. And when they make vaccines, basically what they do is they take a lot of virus, think of M&Ms, they smash them up, and they melt away the chocolate. And then what is in the vaccine is that protein shell, the bits and pieces of that protein shell, because that's what your immune system needs to learn that's not supposed to be in your body, so that when it sees that protein shell later, it attacks it and eliminates it. That's how vaccines work. Now, in the old days just being a handful of years ago, it took months to be able to create the building blocks of the vaccine. But with genome sequencing and all the advances there, that's now done in weeks. And so that has put us way ahead on the curve of vaccine production. So we've got vaccines that are at the point where they can be tested. So remember, this virus, the very first case of it that we looked at was on Christmas Eve. So here we are, you know, just a few months later, and we've already got a vaccine ready for human trial. That is light years faster than what we had just a decade ago. But now that we're in that phase, the testing needs to go just the way it did before, because you can't computer simulate this. So a small number of folks will be given the vaccine to make sure that they don't have some sort of an unexpected negative reaction to it. And if they don't, then we'll go to a larger group of folks. Basically, again, it's another safety evaluation. And then it'll go to an even larger group of folks to not only test the safety, but to see if it actually works in preventing those folks from getting sick. So that's generally 3 steps, because of phase 1, phase 2, and phase 3 trials. And then the phase 4 trial, which you'll hear about, is when it's actually gone to market and they monitor to see. So the fact that we are already in phase 1 trials in a virus that was just first recognized a couple months ago is miraculous. And we need to all be very happy about it. And let's hopefully we move forward, but it's still going to be some time before it's ready for widespread use.
People are scared because the animal phase of the trials have been skipped. So while we are talking all of that, people are still concerned about that. Isn't that a concern to you?
Right. I tell you what, let me let Dr. Peirce speak directly with you on that issue, because when you're talking about proteins and M&M, let me explain it to you in layman's terms, what that means. Stay home, social distancing. You know, let that be your vaccine for right now. Stay home, social distancing, put on your mask. Look, let me thank you all. Let me thank you. And again, let me repeat, let me thank Houstonians for being cooperative, for working with us, for being on the team. Let me thank you. Swamnil Agarwal, let me thank you again for being very, very generous and then helping out the tenants who have lost their jobs and lost their income. And then at the same time, even though we're reporting 402 cases, bear in mind that's from mid-March, 2/3 of that number from mid-March up until today, and the total number in the city of Houston is 1,145, I believe. But when you think about this today, if you want to know how, whether or not what you're doing in the city of Houston is making a difference, just bear in mind, at least as of today, whatever that death count is that's being reported today, at least at this point in time, the city of Houston today did not add one person to that number. We didn't add one person. The death count remains at 10. And so do know that what you're doing is working, and let's continue to work together to flatten the curve and to slow the progression of this virus. Thank you all so very much, and look forward to talking to you again. Thank you.